Well, we're going to learn more about your lung health and also if you're sleeping right. Joining us today, nurse practitioner Evette Shaner. She's with Mercy Health St. Rita's in pulmonary and sleep medicine. So thanks for joining us today.
Thank you for having me.
Okay, let's start out with our lung health, because how do we know, if our lungs are healthy and what condition our lungs are in? Are there certain testings? What kind of things can you look at?
So patients that already have some lung issues, COPD, asthma, a lot of times that they will chronically have some shortness of breath, maybe some cough, things that we're looking for, warning signs to know it's time to be seen. With COPD, for example, would be your cough all of a sudden becomes worse. So the amount of coughing that you're doing daily changes, or the amount of sputum that you're bringing up may change in a color or consistency. The shortness of breath that you're having may suddenly change or worsen. You may feel fatigued, kind of run down, difficulty with doing your daily activities. That's kind of the same with asthma as well. You're going to have more wheezing, increase in coughing, potentially tightness in your chest. These are all warning signs to call your provider and get seen.
So don't brush it off. Don't think that it's okay. This is kind of normal for yourself. Get yourself looked at, right?
Absolutely.
All right. So what kind of help do you have for patients, with this chronic condition?
So we do a lot of prescription management. So the inhalers, as you're showing there, daily maintenance inhalers, rescue inhalers. We educate patients on action plans. So both COPD, asthma, we both have action plans for those to know when your warning signs are and what to do when you have those warning signs. We have St. Rita's also offers smoking cessation classes. We know that smoking is a major cause for lung conditions. And so treating the smoking, trying to get people to quit, it can be very difficult. So having a support group here can be very helpful for patients.
Okay, let's talk about sleep now. Most of us don't get enough sleep. How do we know, when we get to a point where we really need some help and should see a doctor?
So we all know our bodies, and we know that many of us are not getting enough hours of sleep. But major warning signs are going to be excessive daytime sleepiness, that difficulty staying awake at work, during meetings, driving. These are all major warning signs that something may be going on with your sleeping. Loud snoring can be a symptom of a sleep apnea. That brain fog, fatigue during the day. Also, if you're having difficulty staying asleep, so frequent nighttime awakenings can be a symptom of a sleep problem. Some patients will have night terrors, sleepwalking, sleep talking. These are all some warning signs to come in and get seen.
Okay, you mentioned sleep apnea. We hear that a lot. What exactly is that?
So sleep apnea, there's two different types. There's an obstructive sleep apnea, which is the most common type of sleep apnea. And this is when your airway is going to partially or completely collapse repeatedly while sleeping. Central sleep apnea, less common, but this is actually when the brain doesn't send the proper signals to the muscles that control your breathing. And that can cause repeatedly stoppages of your breathing during the nighttime. And both of these are disorders that need to be looked at and need to be treated.
What is the typical treatment for those kind of things? I know lots of people, have CPAP machines and those kind of things.
Absolutely. So PAP therapy, which would be your CPAP or your BiPAP machines, that is going to be your treatment of choice for most obstructive or central sleep apnea patients. There are other treatments out there, just kind of depends on the patient, the symptoms and the severity of their sleep apnea, but we can consider things like an oral appliance, which is a mouth guard that can be worn. Typically, we're educating about weight reduction, and there are certain surgical options available as well.
Also, we've learned through studies, I think, that sleep is really important. So don't brush off this kind of thing either, right?
Absolutely. So sleep is very vital to our health, increases our cognition. It helps with mood stabilization, hormone regulation, just your overall physical health, can help decrease stress. It helps regulate blood pressure and heart rate. People that don't get enough sleep will often find that they get sick easy. So Good sleep hygiene helps improve your immune function. And it can also help when we talk about weight. Patients that aren't getting enough hours of sleep will find it difficult to lose weight as well.
All right. So if someone finds that they're having problems with breathing or with sleeping, what would the first step be?
So you could always talk with your primary care provider first, or you can always give us a call here at our office, and our phone number is 419-996-5053.
All right. Helping us get healthy with our lung health and with our sleep. Thanks very much for joining us today.
Absolutely. Thank you for having me.
All right. Don't go away. Noon Edition continues in a moment.